So a cough is your body's natural way of clearing your airways, so you'll remove things like dust or any irritants that might be present in your lungs or throat. So usually there are 4 different types of cough. You can have a dry cough, a wet cough, a chronic cough, so that's a cough that lasts more than 3 weeks, or whooping cough, which you often see in the younger population. So a dry cough can feel quite scratchy and itchy at the back of the throat and won't produce phlegm. Usually with a wet cough, it will sound deeper and you will often produce phlegm with this kind of cough. So when you're lying flat, that can cause mucus to drip into your throat, which will trigger a cough. Other things like chronic conditions such as asthma can also trigger coughs to be worse at a night time as well. So even after you've recovered from your cold or flu symptoms, your airways might still be a little bit irritated, and that's why you'll still experience at times a cough a few days or even weeks after you're fully recovered. So if your cough is lasting more than 3 weeks, if it's painful, if you're coughing up blood or having difficulty breathing, those are indications that it could be serious, so you should go and seek medical attention. So sometimes repeated coughing can cause your muscles to become a little bit achy. However, if you are experiencing significant pain or difficulty breathing, this could be more serious, so we would say to seek medical attention. So whooping cough is usually quite violent bouts of coughing where the individual will cough, 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 and there will be a whoop sound towards the end of it. It can be really dangerous for babies. There is also a vaccine available to anyone who is pregnant. So a whooping cough is a lot more violent compared to a regular cough, and it's usually associated with the person coughing lots and lots in quite quick succession, and they'll normally make a whoop sound as they breathe in at the end. It's a lot more violent and aggressive than a normal cough. So most coughs are usually caused by colds and flu, allergies, asthma, smoking, and sometimes heartburn. Yes, so the viruses can cause you to have a dry and ongoing cough. Yes, so allergies can make you cough, and for a long time if you are around those triggers for any amount of time, because they can irritate the airways, which will cause you to cough. A long-lasting cough could be caused by things like asthma, allergies, smoking. However, if the cough is new and is lasting more than 3 weeks, we would say to go and seek medical attention. Yes, for some medications, the side effects may well be a cough. So we would say if you are experiencing these symptoms, then always read the label, but to discuss with your GP or pharmacist. So we would always advise to drink lots and stay hydrated. You can try lozenges and warm drinks to help soothe your throat if it's painful. Paracetamol and ibuprofen is very good if you are experiencing pain with that, and just to avoid anything that is irritating it, so exposure to dust or smoke that's not necessary. So we would say to drink lots of fluids and stay hydrated. You need to get plenty of rest, and it's really, really important that you don't try and hold a cough in. So if you need to cough, then cough, because it's your body's natural way of trying to clear those airways. So for some people, they will get relief from cough syrups. This is very individual, so where for some people it's really effective, for other groups of people they will say that it isn't effective. So it's what is working best for you and your symptoms. So your GP might advise and give you antibiotics if they think that your cough is bacterial. However, most coughs are usually caused by viruses and antibiotics are therefore not needed. Honey in warm water, drinking tea, breathing in steam, getting lots of rest and drinking plenty of fluids will all help with your cough. Yes, so some medicines can be taken together, but there are some that can't. So it's always really important to read the label and check this. And if you are unsure, you need to check this with your pharmacist. So you should see your doctor about your cough if it's lasted more than 3 weeks, or if you're experiencing any other symptoms such as weight loss, difficulty breathing, pain in your chest that's quite sharp or severe, or if you are coughing up any visible blood. So coughing up blood or phlegm could be an indication of a more serious infection. So if you are experiencing this, you should see your GP. Yes, so although a very rare, persistent or worrying cough that's going on for a long period of time could be a sign of cancer, tuberculosis or pneumonia, usually you would often experience other symptoms with this, but if you are concerned, we would always say to get booked in with your GP and checked out.